afternoon, everyone. A very warm welcome to our webinar. I do apologize for the technical hitches that we had. We seem to be okay now and we can get on with our program. I am Diana Govender, Health Promotions Manager at the Heart and Stroke Foundation South Africa. I work from our Durban office in KwaZulu-Natal, and I will be your moderator for today's webinar. Some house rules. If we could kindly silence our microphones and switch off our videos so that our speakers are not encountered with any interruptions during the presentations. As you probably know, that September is Heart Awareness Month, and the Heart and Stroke Foundation is embracing the World Heart Federation's theme, which is use your heart to beat cardiovascular disease, and extending the theme to use heart for you, your loved ones, and all those who live in South Africa. Cardiovascular disease is also referred to CVDs and includes heart disease, strokes, and other circulatory diseases. According to the World Heart Federation, cardiovascular disease is the #1 cause of death on the planet. In the time of COVID-19, CVD patients are faced with a double-edged threat. Not only are they more at risk for developing severe forms of the virus, but they may also be afraid to seek ongoing care for their heart. Heart Awareness Month is a big event on our health calendar, and the foundation has teamed up with our long-standing partner, Discount Pharmacies, who will be conducting free health risk assessments. Yes, I said free, namely testing of blood pressure, cholesterol, glucose, body mass index. So please get yourself tested. During Heart Awareness Month, we will be focusing on 4 core themes, dedicating a week to each theme. We had our first webinar last week where Dr. Blanche Cupido, specialist cardiologist and SA Heart President-elect, gave an outstanding presentation on COVID-19 and the cardiovascular patient. In today's webinar, our team of experts from the Heart and Stroke Foundation, South Africa, have a well-thought-out program lined up for us, focusing on nutrition, heart health, and building immunity. Heart Awareness Month culminates on World Heart Day, which is on the 29th of September 2020, where we urge all South Africans to use their hearts to make healthier choices and prevent heart disease. We have 3 speakers for this afternoon's webinar, and I will introduce our speakers as we go along. At the end of the 3 presentations, we will have a session for question time. So please send your questions via the chat group so that our speakers can address these for you. To add value to our webinar, we also have a patient voice from a healthcare professional who will share a testimony with us. I will keep you posted via the chat group to look out for exciting joint ventures that are key partners during Heart Awareness Month, the forthcoming webinars, and other initiatives as well. The presentations will also be recorded for your convenience. I now have the great pleasure in introducing our first speaker, Hayley Kimring. Hayley is our nutrition team leader. As a registered dietitian with a BSc Med Honors in Dietetics, she has over 15 years of experience in quality nutritional care in the private and public sector. Hayley is accomplished in devising meal plans and guidelines for individuals and communities. She also has experience in labeling regulations to ensure that food labels are compliant with SA legislation. Hayley is passionate about science-based education with a vision to empower people to adopt healthy lifestyle. Hayley is based at our national office in Cape Town. I would like to give Hayley a few seconds to share slides with us. Thank you, Hayley.
Thank you, Dana, for that introduction, and good afternoon, everyone, and thank you for joining us for our webinar today. Today, before we start, I'd just like to give you an outline of our talk. We're going to touch briefly on the relationship between COVID-19 and CVD. And then the main focus of our talk is nutrition. So we're going to look at nutrition and CBD, nutrition and the immune system, then a healthy balanced diet, including a healthy shopping list on a budget, and then a bit more about food labels and our Heartmark and DSA endorsement programs. And then we're going to end off with the very topical issue of food insecurity before we go to the Q&As. And then, as Donna mentioned, we have our testimonial from our patient voice, and then I'll just leave you with some takeaway messages. Individuals with heart disease are more vulnerable during the pandemic. A weak immune system makes one more vulnerable during the pandemic. Good nutrition is vital in managing heart conditions and ensuring a strong immune system. An interesting fact, did you know, people with heart disease are at least 6 times more likely to have a heart attack after coming down with the flu. This is because flu causes inflammation that affects different parts of the body, such as the heart. Now, conditions that pose a higher risk of complications if COVID-19 is contracted include heart conditions, vascular disease, and stroke. With stroke, you're 3 times more likely to die from the virus. But the good news is that 80% of premature heart disease and stroke can be prevented by adopting healthy behaviors, which includes a healthy diet. A healthy diet can help lower the risk of heart disease and stroke in a number of ways. Firstly, by improving your cholesterol levels. Secondly, reducing your blood pressure. Thirdly, managing body weight. And lastly, controlling your blood sugar levels. Good nutrition is also essential to a strong immune system. Strong immune system may offer protection from illness and other health problems. And while no one food or supplement can prevent illness, immune system support is achievable by including important nutrients on a regular basis. I'm going to hand you over now to my colleague Kinza, who will talk to you about a healthy, balanced diet.
I would like to introduce Kinza. Kinza Hussain is a registered dietitian based at our Johannesburg branch. She completed a BSc Honours degree in Nutrition and Dietetics from the University of Cape Town. She went on to do a community service at the Kopenhagen Provincial Hospital in Vereeniging. Shortly after, Kinza joined the Heart and Stroke Foundation team to continue feeling a passion for public health. Kinza, if you can share your slides with us.
Okay, thanks, Dana and Haley. So if we're looking at a healthy, balanced diet, we often wonder, what does that exactly mean? Which foods do we include? Which foods do we exclude? So when looking at a healthy, balanced diet, it involves preparing most meals at home, using whole or minimally processed foods. So this way of eating is both healthy for your heart and it can boost your immunity. So now we're going to look at the 6 points to implement in our everyday eating, which will allow you to follow a healthy eating pattern. So the first point is to use less salt. High salt is linked to high blood pressure, and it's advised to reduce our intake to no more than 5 grams from all sources per day. And 5 grams equates to about 1 teaspoon. So in replace of the salt, what we can try to do is we can experiment with fresh or dried herbs and spices for flavor, but it's a stepwise approach. So the first step would be to try and avoid adding extra salt while cooking and at meal times. The second point is to avoid sugary drinks. So diets high in refined carbohydrates from sugary beverages and foods have proven to raise triglycerides, which is a type of fat in our blood. These high sugar foods and drinks have also shown to lower our good cholesterol and increase the bad cholesterol in our body. There's actually been a study that has shown that people consuming one or more sweetened beverages per day had a 20% higher risk of heart disease. In addition, excess sugar has also been shown to decrease the immune system. Point number 3 is to eat plenty of fruits and vegetables. So having a range of fruits and vegetables will provide our body with all the necessary vitamins that are needed for a good immune system. So if we look at some examples, yellow, orange, and dark green vegetables provide precursors for one of our vitamins, vitamin A, which is a crucial regulator for the immune system. On the other hand, bananas and starchy vegetables contain vitamin B6, which is also needed for the onset of an immune response should you fall sick. Citrus fruits, such as oranges, or citrus vegetables, such as tomatoes, have shown to shorten the duration of cold symptoms and reduce risk of contracting the cold. Fruits and vegetables also contain phytonutrients that may help to prevent heart disease. So the recommendation is to have 5 servings of fruits and vegetables together, and just to keep in mind that a variety is just as important as the quantity to get all the benefits we mentioned. Point number 4 is to choose whole grains instead of refined starch. So these are foods such as your whole wheat bread, oats, and brown rice. They are high in fiber, which has proven to lower cholesterol and therefore the risk of heart disease. Interestingly, fiber is also the preferred fuel for the bacteria lining our colon. And keeping these bacteria well fed actually makes for a healthy gut, which is very important because the gut is where 70% of our immune cells live. So you can see fiber is important not only for our heart health, but also for our immunity. Point number 6 is to choose healthy proteins. So these include foods like eggs, tinned fish, your plant proteins like lentils, chickpeas, your chicken, and your lean meat. Lacking protein in the diet has very detrimental effects on the immune system cells. And as a result, it can increase our risk to obtaining infections. Protein sources are also rich in other nutrients which are very important for immunity, such as vitamin D, vitamin B6, and our minerals such as zinc and selenium. The final point is to choose healthy fats. So when we're looking at a healthy heart, what we need to keep in mind is we want to replace the bad fats with good fats. So the bad fats are the industrial-made trans fats in baked and fried foods, and the saturated fats in our animal products. On the other hand, the good fats are our unsaturated fats, which are olive oil, peanut oil, avocados, nuts, flax seeds, and fatty fish. With fatty fish and flax seeds, especially, they contain essential omega-3 fatty acids, which our body cannot make on its own. These fatty acids are very important because they have shown to reduce blood pressure and the risk of stroke. In addition, they also regulate inflammation, which is very important for the functioning of our immune system. So I'll now hand over back to my colleague Hayley, who will talk to us through on how we can actually get these foods in our everyday living.
I'd like to share with you now a healthy shopping list, because eating healthy doesn't have to be expensive. So here are the best food buys on a budget. Firstly, many cheaper vegetables and fruits, such as pumpkin, cabbage, spinach, carrots, apples, and oranges, have just as many nutrients as more expensive varieties. If fruit becomes too expensive, then aim for more vegetables. Then use fresh vegetables to cook large batches of soups, stews, or other dishes, that will make them last longer and provide meal options for a few days. These can also be frozen where possible and then quickly reheated. Also, dry beans, peas, lentils, and soya, which are plant proteins, can be used as meat extenders. They are a great source of vegetable protein and fiber and can be used in a variety of meals such as stews, soups, and salads. Eggs are also a very good source of protein and nutrients. And then whole grains such as pasta and oats not only have a long shelf life to last for longer, but can also be bought in bulk and therefore are cheaper to buy. And lastly, fatty fish are a source of fatty acids, and tinned tuna, pilchards, and sardines are all cost-effective sources of these healthy fatty acids. These foods may all be incorporated into a variety of heart-healthy meals for the whole family to stay strong during the COVID-19 pandemic. Now I'd like to talk a little bit about reading labels. I'm not sure how many of you, when you go shopping, actually pick up the product to read the label, but the first few ingredients listed make up the largest proportion of the foods. Therefore, you should avoid foods with the following listed as the first ingredients: the trans fats, which are the bad fats we talked about, or you may see the word partially hydrogenated fats, which is another word for trans fats, the salt and the sodium, and then MSG, which is a preservative, which is also high in salt, and then lastly sugar, or other words that have the same meaning as sugar, usually ending in OSE, such as sucrose, maltose, and then corn syrup. Now, current research states that front-of-pack labeling schemes, also known as FOP, take preference over back-of-pack nutrition information and are more likely to be noticed. There are four main approaches to front-of-pack labeling, which includes single healthy eating symbols, such as health logos or health endorsements, to indicate which foods are healthier. Front-of-pack labeling is also seen as a low-cost tool in achieving the prevention of non-communicable diseases, such as heart disease and stroke, and promotion of health and wellness. And important to remember that NCDs are the leading causes of death globally, killing more people each year than all other causes combined. Now I'd like to tell you about the Heart and Stroke Foundation South Africa's endorsement program. The Heart Mark and DSA works with food manufacturers to improve food formulation. This means that you don't have to be a nutrition expert or spend hours reading labels. Just look out for our Heart Mark and DSA logos and keep making healthier food choices. The Heart Mark program is managed in accordance with the Food Regulatory Framework and operates with approval of the National Department of Health. The Heart Mark is not a diet, but what it is a guaranteed way to buy food lower in salt, lower in sugar, lower in saturated fats, and higher in fiber. This makes it the best choice for you and your family and the smartest way to keep a healthy and balanced diet. Here are the examples, and I'm sure they're all familiar to most of you: our Heart Mark and our Diabetes SA logos. In fact, our market research shows that 8 in 10, or approximately 77% of consumers, instantly recognize the Heart Mark logo and associate it with healthy eating and a sense of credibility. Now, a little bit about what's happening globally with food labeling. Globally, there's been a movement towards mandatory nutrition labeling, regardless of whether or not a health and or a nutrition claim is made. Currently in South Africa, the regulations do not demand a mandatory nutrition table at the back of the label of a product when a health claim is made, but there are new draft regulations, and when these come into effect, it will include mandatory nutritional information labeling as well as regulation on health claims. So being an ideal time to promote the use of nutrition labels as a tool to reduce NCDs, we ask ourselves, what is the way forward? Simpler food labeling with more graphics and less complex terminology, information overload, and quantitative information. To empower individuals to make healthier choices, the Heart and Stroke Foundation of South Africa supports the regulation of a policy on food labeling and other cost-effective interventions, including regulation of marketing and taxes on unhealthy foods. In addition, lockdown is likely to worsen the dietary risk factors for heart disease through food insecurity. And now I'm going to hand you over to my colleague Prudence to talk about food insecurity.
I would just like to introduce Prudence. Prudence Thele, I hope I've said it right. Prudence, do pardon me if I didn't, is a health promotions officer at the Heart and Stroke Foundation. She recently joined the Heart and Stroke Foundation South Africa. She graduated with a BA in Health Sciences and Social Services as a postgraduate diploma in Public Health, postgraduate diploma in HIV and AIDS Management, and currently pursuing a master's degree in Public Health Nutrition. Prudence is passionate about public health, health promotion, disease prevention, and improving the quality of life for individuals and communities. Thank you, Prudence.
Thank you, Dana, for that introduction. Good afternoon, everyone. We are going to be talking about food insecurity. We know that the right to food is a basic human right for all that protects all individuals from hunger, food insecurity, and malnutrition. But being without food is a violation of that right. So what is it that you're supposed to know now about food insecurity? It is a public health problem that is defined as a state of being without reliable access to sufficient amount of affordable, safe, and nutritious food because of lack of money and other resources. So what do we need to know now about food insecurity during this COVID-19 era? Food insecurity have exposed the already existing inequalities and uncertainties in our country. In South Africa, food security keeps on rising due to poverty, increasing unemployment rates, loss of income, spikes in food prices, climate change, and the outbreak of diseases that include what is happening now with the novel COVID-19. South Africa has been identified as one of the hunger hotspots during this time of COVID-19 among other countries like Afghanistan, Ethiopia, Democratic Republic of Congo, and Yemen, amongst a few. It was said right in the beginning of this pandemic that it was expected that about 12,000 people across the globe could die because of hunger that is driven by COVID-19. It is also stated that in South Africa, even way before COVID-19, 1 in 3 adults would go to bed hungry here in the country. And during the lockdown, especially on the first times of lockdown, the strict one, level 5, about 34% of people in South Africa were going to bed hungry. More than 50% of South Africans are living below the poverty line, where the poverty line alone is 585 Rand per person per month. This has just been adjusted because last month it was actually 561 Rand per person per month. So it has shown that also COVID-19 has also exposed vulnerability and weakness in the already fragile food system in the country. And it is also known that even way before this pandemic, we already had these problems because about 13.7 million people in South Africa were not having access to food or could not afford to buy food due to the existing problems of unemployment, rising food prices, climate change, the lack of access to land or fishing permits. So these are the core concepts of food insecurity, where we're looking at the physical factor that would avoid that will stop people from having access to food. This we're looking at the ability. When we're looking at the physical ability, we're looking at whether people can be strong enough or are they healthy enough to access or to prepare food that is well nutritious for their bodies. We're looking at environmental factors, where it includes poverty, diseases, climate change, global warming, and even geographical variations, because it depends on where you are. Sometimes there are areas where there's no certain foods that people can access to keep their bodies healthy, and the personal factors, which can include the preferences and taste and choices of food they like, preparation of food, the knowledge of what to eat, as well as the restrictions that could be because of their medical conditions or religious preferences. And all these can lead to food insecurity. And then people who might have these medical conditions because their bodies are not well nourished to stand against infections and other diseases. So if these people are therefore food insecure, their diet usually is not good. They're having this poor dietary intake. It's either they cannot take food, or because they don't even have food to take, or maybe they're too sick now to have this food, and that leads to malnutrition. And we are still going to talk about the forms of malnutrition that will also lead to these consequences of chronic diseases and impaired performances. So we are now going to be talking about this malnutrition that is brought by the food insecurity, which is also defined as a condition of insufficient or imbalanced intake of food that is supposed to meet biological requirements. It is also called the double burden of malnutrition because it's either higher or low, that is grouped into 4 dimensions. First dimension of this malnutrition, or the first form of malnutrition, is undernutrition. This is the one that is shown by the nutrients deficiency, or by the lack of nutrients, which is more common in children. It usually presents itself in 3 forms. The first being underweight, where we still children, they have low weight for their age, or stunting, they are low in height for their age, or wasted, they either too thin for their height, which is a result of the weight. And mostly when children are growing with either of these conditions, these forms of undernutrition, they usually don't reach their full potential of their physical or mental well-being, and that exposes them to a number of diseases, could be communicable or non-communicable diseases that they grow with. The second form of malnutrition is micronutrient deficiency, which is a shortage of one or more key nutrient. The micronutrient deficiency is a shortage of one or more key nutrients for optimal growth, development, and for protection. It is more common in children and women in the low-income countries where we're counting Asia and sub-Saharan Africa. Going to the third dimension of malnutrition, which is overnutrition. This one is it is actually common as well. It's a frequent or excessive or overconsumption of imbalanced nutrients than what the body needs. It is usually brought by the lack of knowledge on healthy eating or food preparations. We spoke about that. And could be because of the lack of nutritious, safe, adequate food. So we'll see people consuming the same food that is not healthy just because they don't have access to the healthy, right food to eat. So they, in that way, they will gain weight to be obese or overweight, which is a risk factor for most of the diseases that we are going to talk about now on the fourth dimension of malnutrition, which is a diet-related non-communicable diseases. These conditions, these diseases, they are the most common causes of mortality and morbidity globally and here in our country. They are usually due to the transition from what we used to know as a traditional diet to the new Western refined processed diet that has more sugar, fats, and salt. It is also due to an inadequate or imbalanced consumption of nutrients that exposes people to these conditions that we're talking about, cardiovascular diseases like hypocholesterolemia, hypertension, obesity, diabetes, and all other conditions. These are the most common risk factors of the cardiovascular diseases. So now we're talking about food insecurity and health, how food insecurity impacts health on our daily living. This cycle is like a cycle that is going on and on and on. If one problem is not solved, then the cycle continues. So it's like a cycle of food insecurity and these chronic diseases. It begins with a stress of not being able to afford food or being able to access food that is enough for your body to consume, that is healthy enough for you to fight off diseases, to build a healthy immune system that my colleagues have already spoken about. So this is a hunger-related stress that increases the risk of non-communicable diseases that includes cardiovascular diseases, stroke, heart attack, including as well hypertension, diabetes, and other conditions. These conditions are also known to be the comorbidities that worsen the condition if a person is infected by the current pandemic of COVID-19. So because of these, it's difficult to have adequate money to combat these conditions, because it's a feather that. Oh, Kanya, can she please mute himself, Connie? Okay, going on to the last point on the food insecurity and health, it is noted that the time and money that is needed to respond to these health conditions, they will strain the health budgets, because it's like now you must choose whether you buying food or you treating yourself. So with the little money that you have, you must decide that you're buying food or you're buying. Either way, one of that is going to suffer, and then the cycle will continue. This cycle that we're talking about of hunger and stress and diseases. So this is the cycle we're talking about. Like when we say here, when there's food insecurity, usually the quality of food will drop, because people will either trade off quality for quantity, so that you'll know that at least you have food that will take you longer than quality food that will last you just for a few days. So that stress of not having enough food, not eating enough will rise. And then that combination of not getting enough food and not having and not will also give you now lead to chronic diseases that we just spoken about. And most of the time when you are developing these chronic diseases, you'll need frequent visits to the healthcare centers, and that will need money. It's either you are taking more time off work to go and attend to these conditions, or because you are too sick, you're having lots of symptoms that are not good enough for you to work, then the employee rate will drop. You either be suspended or you're taking time off. Others, they pay because they like pay as you earn, pay as you work. If you go to work, that's how you paid. If you're not going, then you're not going to pay. And that will impact the employability of a person. Obviously, that will strain the finances, taking back to the food insecurity, of which this cycle continues and continues if one problem is not solved. So what can we do then for this food insecurity? There are few or more strategies that others are not shared here, but we'll go to the few one, because food insecurity is associated with higher prevalence of inadequate key nutrients that the body needs. So this can be corrected by reducing the intake of unhealthy foods, because there are times when we know what to take, but we prefer foods that are faster, that are so easy to get, that are even expensive than healthy foods. So the other point is to make healthier eating choices than expensive ones, like my colleague has spoken about, eating cabbages, spinaches, pumpkins that are so cheaper than expensive unhealthy foods. And then people can choose to grow their own vegetables, because when this food insecurity worsens, it was the time of COVID-19 lockdown, and most people were staying at home, and they were saying they were bored, they didn't have things to do. So this was a chance for people who have space, who have time, to grow their own vegetables, so it can be accessible and cheaper and healthy. And the other thing that we can hope for is that the government can ensure that all South Africans are food secured by improving availability and accessibility of nutritious food that is fairly distributed to everyone. So this is like an ideal vision of food security, where everything is in equilibrium, where the policies are in space, employment rate is high, and everybody can afford their own food. They're living a healthy life. Everything is at the balance. We're all getting food. There's balance between supply and demand of food. It's like the whole vision that every country has of food security, that we're hoping that one day we will actually live to that ideal vision. Thank you. I'm now going to hand over back to our moderator, Dana, for our Q's and A's. Thank you.
Thank you, Prudence. I just want to go back to our speakers. I see we don't have any questions. In the meantime, we'll just wait for some questions to come through to the group chat. Haley, thank you for an amazing presentation. You've enlightened us on some very essential elements to the importance of a strong immune system, and that good nutrition is vital in managing heart conditions. And you also brought out some very new, some insights, especially when you mentioned that people with heart disease are at least 6 times more likely to have a heart attack after coming down with the flu. And I think, you know, we all tend to shy away from the flu vaccines, but I think it's so important, especially if you're amongst the high-risk group, to have yourself vaccinated. And I think as part of the risk reduction strategies that you spoke about, like lowering your BMI, watching your sugar and salt intake, and to keep an eye on the blood pressure and cholesterol level, it's also, I think, very important to remind our public, members of the public, about the flu vaccine as well. So that is an important health tip. Thank you so much for that. And I think, Kinza, thank you for a great presentation. I think, you know, your presentation also highlighted that eating healthy is more than just nutrients and counting calories. Eating healthy is about food choices we make every day and how these choices add up to affect our health. It's about making smart food choices most of the times and eating better. And healthy eating is not only about a diet, but rather a long-term eating habits. Thank you for that. And it's also evident that no one food or supplement can prevent illness. We need to enjoy a variety of foods, a healthy diet, physical activity, not smoking, a healthy immune system, all help in the fight against heart and stroke disease. And I think our message, if each South African just does one thing to improve heart health this September, that's a step in the right direction. Thank you for that, Kenza. Excellent presentation. Prudence, yes, yours was a very insightful presentation, and the topic is so timely. And you presented the material that resonates to the situations before, as well as you know, during the pandemic. And you know, it's a grave concern that South Africa has been identified as one of the hunger hotspots among countries like Afghanistan, Ethiopia, and the Republic of Congo. So, and you give us even more shocking stats that 50%, more than 50% of South Africans are living below the poverty line. And even before the pandemic, that 13.7 million people did not have access to food or could not afford food. And I think kudos goes to all our communities and all the stakeholders, you know, who actually supported our communities during the pandemic. And, you know, these included NGOs, CBOs, faith-based organizations, the public and the private sectors, who all assisted households with essential food parcels and to go through this very distressful times. Thank you so much for that, Prudence. A very informative presentation. We still, I'm just looking at some of the questions. Okay, this question is from Kamagelu. Wonderful presentation. How do we help promotions at this time promote healthy eating, because patients are perceiving that multivitamins will protect them against COVID-19, neglecting healthy eating in general? Very good question.
Hi, if I could start off with answering that question. The first choice is always healthy eating. The only reason one would need to take a supplement is when the diet is deficient in one or more nutrients. But even in the chemical form, the nutrients you receive from multi-supplements aren't as beneficial as those you get from eating a healthy, balanced diet. So the first prize is to first go for a healthy, balanced diet and not to waste your money on expensive supplements. I don't know if any one of my colleagues want to add to that.
Kinza, do you want to comment on that? What Haley has said?
Sure, Dana. Yeah, I think to continue promoting whole foods, I think we need to just keep doing, as we mentioned today, where we mention the foods, like we say, what do our fruits and vegetables have? And in season, fruits and vegetables are not expensive, and they will give you these vitamins and these minerals. What do our plant proteins give us? What are our plant proteins, and how can we include them in our diet? So just to keep repeating those foods and what each foods contain, just to remind the public that they can get their vitamins and minerals from the foods. And as Haley mentioned, only if you have a deficiency, and it's visible that you have a deficiency, that you need to supplement on top of that.
Thank you, Kinza. Thank you, Kinza. All right. I think we don't seem to have any more questions. Oh, there's one from Renata. May I make a suggestion? Is it possible to draw up a shopping list of foods that the public can buy with the monthly amount that you spoke about per person? Haley, do you want to take that?
Hi, yes, thank you for the question. As I mentioned, healthy eating doesn't have to be expensive. As I mentioned with my healthy shopping list, and I can go through some of the suggestions again, we don't actually have an attached budget to it, but it would be easy to calculate one and get back to you on the cost per meal per person in the household. But as I mentioned, firstly, all the cheaper vegetables and fruits like pumpkin, cabbage, spinach, carrots, apples, and oranges have just as many nutrients as the more expensive ones. And then if fruit is too expensive, then aim for more veggies. Also, the use of fresh vegetables to cook large batches of soups and stews and other dishes will enable you to freeze them and use them again in other meals like soups and stews. Then, very important to include our plant proteins, which are inexpensive, but also a very high quality source of protein. And these are our dried beans, peas, lentils, and soya, which can be used as meat extenders. In other words, if you're making a meat dish, maybe use a quarter of the meat and 3/4 of your legumes. And these legumes are great sources of vegetable protein and fiber, and they also can be used in a variety of meals such as stews, soups, and salads. Then to think of foods that can be bought in bulk, which are also cheaper, such as your whole grains, pasta, and oats, which all have a long shelf life to last for longer. And then for a good source of omega-3s, which are not only healthy for your heart, but also boost your immune system, canned pilchards, sardines, and tuna are all cost-effective. And in fact, according to the Heart and Stroke Foundation, they should be eaten at least twice a week. So I hope this gives you some examples of foods to include on your healthy shopping list on a budget.
Thank you, Haley, for that, answering that question. I do not see any other questions, but I just want to reiterate the testings that are going to be done at this camp for the whole of September, Heart Awareness Month. It's going to be blood pressure, cholesterol, blood glucose, and BMI. Those are the testings. Okay. I think just as also to inform our participants that if you do have any questions or any concerns, you can also call our speakers on our health chat line, where you can discuss your cardiovascular concerns. Please book in and get a slot with any one of our speakers. And also, if you want to talk to any professional staff from the Heart Foundation, you're welcome to do that via the health chat line as well. Okay, since we don't have any more questions, I would like now, Haley, you've got Jessica's information with you? Or would you like me to introduce her to? All right, let me, a little information about Jessica. Jessica Perumal is our patient voice for today's webinar. And Jessica is no stranger to the Heart and Stroke Foundation. She has worked with the KZN team on a number of projects and played a pivotal role as a volunteer in many of our community projects to raise awareness on cardiovascular disease and its prevention. We at the foundation are very grateful to Jessica for taking the time to share a testimony with us this afternoon. And you know, I think the foundation also calls on all South Africans to use this Heart Awareness Month to show appreciation and support to all our healthcare professionals, our allied and essential workers, as you are our main asset in this war against the coronavirus. So we will hand over to Jessica, if you can kindly share your testimony with us.
Good day all. I'm Jessica Perumal, as you've heard, an enrolled nursing auxiliary working at a dialysis clinic. And I have to say I'm grateful for the opportunity to share my positive COVID-19 story today. One of the things I've noticed is that most people are so afraid, and it's that fear that's actually preventing them from educating themselves on how to go about fighting this virus, and it's sad. And I believe that early detection increases your chances to actually fight back and gain control of what's going on with your body before the virus can actually reach your lungs and other organs of your body. I was experiencing ordinary flu symptoms, and I just lost my smelling senses. But once I learned that a patient that I had come in contact with had actually tested positive, I immediately got myself tested. And even before getting my results, I told myself that I will not be afraid, because I know that if I'm educated on something, I would have the weapons to fight back. So what I did was I immediately got whatever information I could from the internet and from other people that have been through it, and I educated myself on what was needed to gain control. And one of the common things that I did hear about when I was doing my research was the importance of garlic and zinc, and the way it helps you to build your immune system. So I had already been taking women multivitamins for at least a couple of years now, and garlic and parsley is something I started taking at the beginning of the COVID pandemic, because friends of mine had been taking it prior to that, and so with talking, we learned from each other. So apart from the supplements that I'd been taking, I found that the vitamin C and all the things that we get out of our foods were not that hard to get if you just go and buy the fruits and the vegetables that the stores had. So I changed my entire eating pattern, and I started to eat healthier. I started eating eggs every day. It became my breakfast every morning. I had it either boiled or scrambled or in an omelette. So that was my breakfast. My lunch, despite the fact that I didn't want to eat, my kids ensured that I had lunch every day, which was broad beans with roti, or chicken and mayo sandwich, or tuna toasted sandwiches, at least something so that I could stay strong. And I love vegetables and fruit, so it wasn't that difficult. And my fruit, was strawberry, pineapples, oranges, and bananas. Those, I changed them all the time, but those were my favorites throughout that period that I was in quarantine. And supper, if you hear from anyone that had the COVID-19, it was, you just didn't want to eat. But I made sure that I had at least had the 3 meals so that I could have enough strength to fight this virus. So my supper would be just grilled fish or grilled chicken or grilled meat with either baked potato or mashed potato on the side, because I love potatoes. So I just didn't want to eat heavily. So bread and rice I stayed away from, but those things by itself, coupled with carrots, lettuce, and cucumber salad, it really helped me not just to feel better, but also to get stronger. And not forgetting the fluids, I drank a hell of a lot of water and vitamin C juice during that time, because my respiratory airways were all dry. And so I continuously drank a lot of water. And yeah. And I've gotten so used to eating that way that even after my 10 days were up and I was feeling stronger and better, I still stuck with the thing of avoiding the rice and the bread during the week. So my kids and I, it really helps when an entire family becomes health conscious, because it's much more affordable when you have to buy just for an entire family. So we've all started having the grills every day, and salads and fruit and vegetables with our meals. And we've just stayed away from the carbohydrates. So that's our weekend thing. And even when it comes to the rice, I've opted now to start cooking basmati and brown rice. I never realized how tasty it would be. So yeah, we learn from our experience and from the changes, and the way when you make the changes, you notice the difference your body starts to feel. And I feel so much better. I may still need to get more strength, because it's not easy after your COVID experience. It kind of drains your body. But with the help of all of those fruits, vegetables, and proteins that we have together as a balanced diet, most definitely I do feel myself getting stronger daily. So this world pandemic has taught me that with a positive mindset and a willingness to change old habits, we are strong enough to fight this. And changing my eating habits hasn't been a problem. It's actually exciting when you start to see yourself look better and feel better. So I'm quite sure that by summer, I just might have that summer body. Anyways, thank you all for listening, and God bless you. Stay safe and fear not, because fear is something that is really holding our people back from fighting the pandemic. And just have hope. God bless you all. Thank you.
Jessica, thank you so much for that amazing testimonial. I think you're so strong and you're so positive, and you're looking so well. So that is great. Thank you for sharing that with us. Thank you. And thank you for making the time, because I know how busy you are. You guys are saving lives, and you made the time to be with us, and that's really, really appreciated from all of us.
It's my pleasure. Thank you. And thank you to the rest of your team. God bless you all.
Thank you, Jessica. I'm going to now hand over to Haley. Haley's got some key messages for us. Haley, you want to share your slide?
Thank you, Donna, and thank you, Jessica, for sharing your amazing story with us. I'd like to leave you with a few takeaways today. Firstly, individuals with heart disease are at higher risks of complications from COVID-19. 80% of premature heart disease and stroke can be prevented by adopting healthy behaviors, including a healthy diet. Good nutrition is essential for a strong immune system. A healthy diet includes whole foods such as fruit and vegetables, whole grains, healthy proteins and good fats, and limiting foods high in added sugars, fats, and salt. We recommend that you reduce your salt intake to no more than 5 grams, which equates to 1 teaspoon of salt from all sources a day. Remember, you don't have to spend hours reading labels. Always look out for the heart mark and DSA logos to help you make healthier choices for you and your family. Lockdown is likely to worsen the dietary risk factors for heart disease. Firstly, through food insecurity due to a rise in food prices and limited access to safe and nutritious foods. And secondly, reliance on nutrient-poor, cheap, ultra-processed foods. Both under and overnutrition play a vital role in the development and management of heart disease. So disease prevention efforts should address all forms of malnutrition. The Heart and Stroke Foundation supports the regulation of a policy on nutrition labeling of food and other cost-effective interventions, and calls for urgent action to end this hunger crisis and build fairer, more robust and sustainable food systems. With that, we've come to the end of today's presentation, and I'd like to thank all our speakers and all of you out there who made time to attend our important presentation today. Thank you, everybody.
Thank you.
Thank you, everyone. I think just to note that our working world is opening up under lockdown level 2, making it all more important to observe the golden rules of social distancing, sanitizing, and wearing a mask. From our CEO, Professor Pamela Laidu, and all at the Heart and Stroke Foundation, South Africa, I would like to extend our wishes that you stay healthy and safe over this time. And also remember, September 29th, we'll see countries around the world collaborating to raise